This is the normal ultrasonographic image of right kidney. Here you can see this slightly hyperechoic homogeneous appearing structure is liver. This echogenic thin rim of the tissue represents renal capsule. The space between kidney and liver is called hepatorenal space. So this space is the potential space for fluid collection in case of trauma or in case of ascites. The outer part of the kidney is called renal parenchyma, and this inner echogenic part is called renal sinus. Renal parenchyma is again divided into outer slightly hyperechoic renal cortex and inner slightly less echogenic renal medulla. This entire bright appearing echogenic part is renal sinus. Renal sinus appears white in ultrasound as it contains fat. Fat appears echogenic in ultrasound. Renal sinus contains renal vessels, calyces, and renal pelvis. In normal kidney, as calyces and renal pelvis are located inside the echogenic renal sinus, these are not usually visible. But in case of hydronephrosis, renal pelvis dilate with urine and appears hypoechoic. Look at the second image. Inside this echogenic renal sinus, you can see a fluid-filled space called renal pelvis. Calyceal system are not clearly visible. In grade 1 hydronephrosis, only renal pelvis is dilated. Now look at the second image. You can see along with the renal pelvis, the major calyces are also dilated. However, you cannot see dilated minor calyces. In grade 2 hydronephrosis, only few calyces are dilated along with renal pelvis. Grade 1 and grade 2 hydronephrosis are considered as mild hydronephrosis. Now look at this image. You can see all the visible calyces are dilated. Also you can see this ballooning of the calyceal system. Dilatation of all pelvic calyceal system of the kidney with ballooning of the pelvic calyceal system is considered as grade 3 or moderate hydronephrosis. In this image, you can see there is a severe dilatation of the pelvic calyceal system with thinning of the renal parenchyma. Normal parenchymal thickness is 15 to 20 mm. So if the renal parenchyma is less than 15 mm with severe dilatation of all the calyceal system, this is considered as severe hydronephrosis. In this image, you can see severe hydronephrosis with cortical thinnings. If you closely look at inside the lumen of this dilated collecting system, you can see echogenic content. This echogenic content in background of severe hydronephrosis represents pus. Thus, this condition is called pyonephrosis. It is always important to rule out pyonephrosis in obstructive uropathy because pyonephrosis is considered as a medical emergency and urgent decompression of the kidney is necessary. As pyonephrosis is associated with relatively rapid deterioration of renal function as well as higher risk of sepsis and septic shock. Now let's talk about some mimics of the hydronephrosis. Dilated collecting system may not be always due to hydronephrosis. Look at this image. This entire structure is kidney. Inside this renal sinus, you can see dilated renal pelvis filled with urine. However, if you closely look at this calyceal system, not even a single calyx is dilated. This is called extrarenal pelvis. Extrarenal pelvis is a normal variant where renal pelvis is located predominantly outside the kidney, mimicking hydronephrosis. Extrarenal pelvis is better visualized in transverse image. This is the transverse image of the kidney. You can see renal pelvis is bulging outside the kidney and there is no associated calyceal system dilatation. Hence, this is extrarenal pelvis, not the hydronephrosis. Now look at this image. In first image, there is dilated renal pelvis and few calyces. So this is hydronephrosis. In second image, there is anechoic cystic lesion in renal sinus. This structure does not communicate with collecting system. Though it is present in the renal sinus area, it remains separate from renal pelvis and calyceal system. Again, if you see the posterior aspect of this lesion, you can see posterior acoustic enhancement. So this is parapelvic cyst and this is not hydronephrosis, as this cyst is not communicating with collecting system. If communicate with collecting system, hydronephrosis. If not, then parapelvic.